Okay, now we're going to discuss another airway clearance device, the TheraVest. The TheraVest is designed to do chest wall percussion, external chest wall percussion, whereas the acapella and the Curiplex actually did intrapulmonary or inside the chest percussion. This is energy applied to the outside of the chest wall. One of the first things that you'll have to do with your patient is put the wrap on. This is just a wrap, and it will go around the chest. Move this out of the way. So this just wraps like this. There. And I have my hoses. Okay? Now, the hoses, you have two big blue hoses that connect to the front. There's not a right or left there. This black hose is a self-start, so you probably will not use it that much in the hospital, but it's just a bulb that will self-start and stop. This is so people can deliver treatments to themselves. This is really used a lot with cystic fibrosis patients. And you have the power cord in the back plugs up. That's all the connections that you really have. When you first plug it up, it will go through its own self-test. Now I will get the glare off of it. So it did its own self-test, and then you can click on. It'll ask you if you want a custom treatment or a normal treatment. We're just going to go with normal. Then it says 10 hertz, 10, and then the minutes. The hertz is basically how many times a second it's going to beat. So don't have to worry about that. So this is how fast is it going to hit like this or hit like that. That's all hertz are, is how many hits per minute. The 10 is how hard the hit's going to be. These little buttons are arrows up and down. And then this one will determine how long the treatment is. 10 minutes, 15, 20, whatever. So we're going to leave it here, 10 hertz, 7. And a lot of times the patients who use this already know what works for them, and they have their settings. Do a little twist. I will hook my hoses up to the side. And then I'm going to turn it on. Then once I turn it on, my vest has inflated. It's gotten big, and then it says start therapy, press on. So I can press on. Now you want this high enough so it does not hit their diaphragm. And then the patient will do the therapy. And that is how you do the therapy. So if it's too hard, you can decrease the intensity while it's running. I just decreased it to 1, and you may be able to see, if not hear it in my voice. I take it back up to 10. It's hitting a little bit harder now. And then with the 10 hertz, you can actually see it goes down to 5. You can actually see how much less it's hitting. If I take it up, you can really go up. 20 is the max hertz. That's a little much. Just knowing what the hertz are how many hits, low hertz, high hertz. The other number is how hard, and then you set the time. You set it to the patient comfort. Most patients that are using this, and you press off to stop it. Most patients that use this understand and know what works for them. And that is the TheraVest.